So that's the technical element of what we have today. So now it's my pleasure to introduce our speakers who have graciously agreed to spend time with us and share their knowledge. We have Nathan T. Chomillo here. He is Medicaid Medical Director with the state of Minnesota, COVID-19 Vaccine Equity Director with the Minnesota Department of Health, and an internal medicine hospitalist and pediatrician at Health Partners Park Nicollet. Chris Erzman is Director, Infectious Disease Epidemiology, Prevention and Control Division at the State of Minnesota Department of Health. And Stacy Johnston is an attorney and the founder of Audacity HR, which is based in Duluth. So join me in welcoming all three of them. Stacy is going to start us off. Go ahead, Stacy.
Thank you and welcome. Thanks for tuning in for this really important conversation. Whoops. For some reason, it's not tracking forward. Okay, here we go. So today we are talking about COVID-19, and the lens that I bring to this conversation is what it means for the employment, from the employment landscape. And of course, the things that we'll be talking about is informational in nature. And for some of these really complex decisions that you'll be making for your organizations, really important to reach out to the experts that you have in your community for some of these decisions. And so we will talk about what do the vaccinations mean for your organization specifically. And I wanted to bring up some conversation about some of the hesitancy that we're seeing in our organizations around COVID-19 and the vaccinations. And I know Nathan and Chris will be bringing a lot more information and stats around this. So I will just talk very briefly about some information specific to the workplace in regards to this poll that was done by SHRM, which is the Society for Human Resource Management, and they asked employers and employees in regards to their comfort around vaccinations. And it's really clear to see by this poll that there's still that there's really a rift and that there is still a lot of disagreement in regards to the workplace. And interestingly enough, that 28% of the people that responded to this poll said they wouldn't get the vaccination, even if it meant losing their position or losing their job. And yet 33% of the people that responded to this poll felt that the vaccinations should be mandatory. So you can see from just these stats that employers are really navigating some tricky waters in regards to making these decisions, and that there can be sometimes a lot of disagreement with your workers in regards to the vaccination and next steps for employers. There was also some information about why employees didn't want to get vaccinated, showing that there's still concern around side effects and people were nervous about the side effects. They didn't know yet whether it was still safe. They kind of wanted other people to, have the vaccine and then take their time getting that vaccine. Also, there's some people that just weren't there yet in regards to trust. And so it's important for employers to keep this sort of information in mind when you're making these decisions. Of course, there's also intricate legal considerations that you must consider in regards to staying compliant with the laws that shape the employment landscape. So making sure that you're staying in compliance with the rules and laws that apply to you. So importantly, we'll talk about the federal landscape. And one of the first things that you should be considering is the EEOC rules and regulations. So that's the Equal Employment Opportunity Commission. And they have been very actively involved in regards to the pandemic itself and helping employers to guide decisions And right now, of course, the reason that we're all tuned in today is what about vaccinations? What can we do and what can't we do? Really important for employers to keep in mind that you must provide, if the EEOC applies to your organization, that you would be required to provide reasonable accommodation in the case of medical disability or for religious purposes. So a lot of the questions that I'm getting and that I'm talking with employers about are things like, can we make vaccinations mandatory? And the EEOC has provided guidance that says that there's nothing that doesn't allow employers to make them mandatory, which I think that's interesting in and of itself of how that language is phrased by the EEOC. So they're not necessarily saying, yes, go ahead, make it mandatory. They're saying that there's nothing prohibiting an employer from making it mandatory as long as it is, as long as it's consistent with business necessity. And you have to keep in mind that if that's the decision that you make as an employer, that you would be required to provide reasonable accommodation if you had workers that couldn't receive the vaccination because of religious purposes or because of disability related purposes. And so that's a real careful consideration. And something that I'm having a lot of conversations with employers is making that optional rather than mandatory. Another question that I'm getting very frequently from employers is, can we encourage people to get the vaccination? Because there's still a lot of confusion about what employers can and can't say to their workforce. And so the EEOC has also provided us with guidance that yes, it's okay to encourage employees and to provide relevant information, which Nathan and Chris will be providing us with great information that we can share with our employees in regards to the vaccination and the safety of the vaccination. Another question that I frequently get is in regards, well, can we incentivize the vaccination? Can we provide a little bit of an incentive for people to take that vaccination? And again, as long as it's not too onerous, that generally the EEOC has indicated that yes, it's okay to provide a small incentive to help employees kind of urge and nudge them along to getting that vaccination. One way that you could do that, of course, and the one way that the EEOC outlines for us as an option is to provide paid time in order to go and get that vaccination. Of course, as we're navigating these conversations, we have to make sure that it is really important that we're not discriminating against employees and that we're staying abreast of the rules and the laws that impact us. Also, a really important consideration for employers is to make sure that your employees feel safe to come forward with any concerns, that they know who to talk to about any concerns, and that they know they can bring up these concerns without fear of retaliation. Super important conversations to be having with your employees. The EEOC has offered us guidance in that is one way that we can continue to navigate these difficult decisions is by having very transparent conversations with employees and making sure that those channels of communication are open. And so that might mean that you're communicating in multiple different channels with employees and making sure that you're providing it in language that they can actually understand. So if it's too complicated or if it's not in a language that they understand, of course, that communication isn't doing much help for those folks on your workforce. The EEOC has also provided us with guidance, which there should be a link in the chat, and it walks through a lot of Q&A. And so I recommend that you take a look at this guidance. And there's this section K is specifically on vaccinations. So as employers, you'll be making these decisions for your workforce about whether or not to make reasonable accommodation unless it creates an undue hardship for your organization. And this is when you would be what we call the interactive process, when you're having conversation and dialogue with your employees to determine what are they asking for and what can we provide without it being an undue burden on our organization. Thanks so much, Shannon, for throwing that link in the chat. So another important consideration is the OSHA guidance. And so there's also a lot of decisions that employers should be looking at in regards to keeping your employees safe at work. So of course, there's a lot of standards that OSHA has been deeply involved with in regards to keeping a safe workforce and making sure that employees have access to bring up concerns, to talk about their safety concerns, again, without fear of retaliation. So Shannon just threw another link in the chat for you, and I really encourage everyone to take a look at this guidance from OSHA. And so they have specific guidance for healthcare employees and people that are in the healthcare field. And then there's also guidance for all employers in regards to what steps can you take to keep your employees safe. So for example, I've received a lot of questions in regards to what do we do about employees and their vaccination status? And what do we do if for vaccinated versus non-vaccinated individuals? And can we have different internal rules in regards to that vaccination status? And so of course, the broader landscape is to make sure that you're complying with federal rules, make sure that you're applying with state rules, and then there may be local ordinances that also apply to your organization. So make sure that you're keeping tabs on what's going on in your community. And then generally, we've received guidance that you can differentiate between individuals in regards to masking and not masking if you're complying with things like the CDC. So the EEOC has let us know that we can follow CDC regulations, and they are actually busy trying to update their guidelines in order to comply with the CDC regulations that recently changed. So another question that I've received, and a lot of employers are really navigating some questions like, what do we do with employers that aren't vaccinated? And what if we have high-risk employees in the workplace and they may be interacting with employees that aren't vaccinated, or they may be in a customer or client-facing role and they may be interacting with individuals that aren't vaccinated? And I think that this is an area for employers, again, to really communicate and to be clear in regards to what the policies and the expectations are, to be very clear that there may be many reasons why people wear masks or decide to continue to wear a mask in the workplace, even if they are vaccinated. So one thing that you want to make sure that you're avoiding is that there's some semblance of bullying or shaming in the workplace in regards to whether or not an employee is wearing a mask. So making sure that you're avoiding any retaliation, any of that nastiness that can happen, and making sure that you're really insisting that people treat each other with respect, having frequent dialogue and making sure that people understand that they shouldn't need to, explain their entire history in regards to whether or not they can or can't receive a vaccination with their coworkers, and that we need to be able to approach the workplace with some respect. So interestingly enough, that there's information that shows that there's information from the EEOC that allows us to ask a yes/no question in regards to an employer finding out whether or not an employee has received a vaccination. And so that in and of itself is a question that you can ask, because you may have to shape some policies and some guidelines based on whether or not an employee is vaccinated. And so beyond that, however, you should make sure that you move forward with caution, because beyond that yes or no answer, you may have access to confidential medical information about your employees. And you want to make sure that you treat that with, of course, with utmost respect and confidentially. So the EEOC provides us with guidelines that we should keep confidential information about our employees separate from their regular employee file. So if you have information that you have obtained from your employees in regards to that vaccination status, you're making sure that you're treating that as confidential information. Next slide, please. So as we continue down this journey, we will also, of course, keep in mind the rules and regulations that impact us on the state level. And next slide. And of course, within Minnesota, but if you happen to be doing business in other states, here's where some complexities come in for you as an employer, is that you need to keep track of the conversation and the rules and the guidelines that are happening in the states that you're working in and doing business in. And so that's where it can get a little bit complicated, that you're not only looking at the federal rules, you're also looking at the state you're operating in, and then you're looking at those specific jurisdictions, such as Minneapolis or St. Paul. They may have ordinances or rules that impact the employers that are within their jurisdiction. Next slide, please. You want to make sure that you're regularly checking into your plans, regularly checking into your process. It's incredible, but this information may even change day by day, week by week. And so whatever you decide to do for this week, you may have to update that in a couple of weeks or by next month. I'm sure many of you have preparedness plans, and you've updated your preparedness plans, 7 or 8 times by now, because the guidelines continue to change. Next slide, please. So I think a preparedness plan is a great tool for you to utilize and to continue to communicate with your employees. And it continues to shape and very clearly outline what are the expectations, because things are changing and because things we know will continue to change. That's an easy way to clarify, and it's an easy way to keep this information in front of mind for your employees. Next slide. And then, of course, we have a lot of decisions to make, and carefully navigating those decisions and knowing that you have that conversation around, some of your workforce may be vaccinated, some may not be vaccinated. And how do you return to the workforce, and how do you do that in a planful way, and giving people information and planning it out so that it doesn't feel like there's any surprises, and that people generally can have enough time to process and ask questions. You may also, if you're already back in the office, which a lot of people are already back in the office, or they have a portion of the workforce that's already at the office, a portion that's returning, then you may have to be navigating some questions, such as you have some employees who are not yet vaccinated. Do you need to provide extra precautions? Or you have some employees who are high risk, and do you need to continue to provide extra precautions? Do you need to continue to stagger breaks? Do you need to continue to use physical barriers? Do you need to make sure that people are physically distanced from one another? So we still have a lot of questions to look at. Next slide, please. And next slide. We're also looking at hybrid schedules. And so I'm throwing that out there as another topic for consideration in regards to your conversations around one, workplace flexibility for individuals, and then two, working outside of the office may be a perfect, reasonable accommodation if you're struggling with how to put all these puzzle pieces together for your employees. And next slide. And I think we must be getting towards the end. Next slide, please. If you have specific questions, feel free to reach out. I know it can be hard to ask a question sometimes when you're in a Q&A, or it feels like it's a little bit more of a private question that you don't want blasted out. So feel free to reach out to me directly if you have specific questions. And last slide.
Thanks so much, Stacy. That was really helpful. So just with timing concerns, I know we said we would take questions after each speaker, but I am unilaterally making a change. So we're going to hold questions until the end, and we're just going to go right to our next speaker. So Nathan, take it away.
So it's not letting me share. So
I invited you. It says it's waiting for you to accept, and if not, I can advance for you.
yeah, I'll always have you advance.
Okay.
Good afternoon. My name is Dr. Nathan Chumlo. As was introduced, I'm a pediatrician and internist who also helped lead the state's Medicaid agency as Medicaid medical director, and then since April has been serving as vaccine equity director for the Department of Health. And I'll be covering, building off of Stacy's talk about how do we navigate some of these conversations around the COVID-19 vaccine with not just our staff members, but really our friends, family, neighbors, those around us. I think it's really important whenever we're talking in community to acknowledge that the state and healthcare in particular have been part of violating the trust of so many of our community members, which contributes to many of the health disparities we do see. Coming and working in community and showing up is one of the ways we can help rebuild trust going forward. So we do see, unfortunately, still the evidence though. Next slide. Forgot for a second. So do the vertical, and then next slide. So this is on our state vaccine dashboard, and this is looking at vaccination rates by social vulnerability index. And this is one of the ways we have been really measuring our ability to equitably reach and vaccinate all communities in our state. The social vulnerability index does capture a bunch of different factors. Really, I term as like historical underinvestment in communities. And so it looks at the community's level of education, of income, housing, and those who are unstably housed, transportation access, the number of individuals who are disabled over the age of 5, number of individuals who are young or amongst our elders, and then those who are in minoritized communities or speak a language different than English. And so it uses that to create a score of what is an area's general disadvantage. And so areas of high disadvantage that you see here are, or high risk, are quartile 1. SVI areas in the state, and you can see here that they are and have throughout the pandemic had lower vaccination rates. I think that's due to a number of issues, both again some of the distrust that exists because of the violation of trust. Some of it is just structural in the fact that many members of the communities didn't have access to vaccines from as early as others in the rollout of the vaccine, and they continue to face barriers, whether it's support at workplaces, whether it's support within their communities, And so just to say that there are different rates depending on the communities that we come from. And we see, next slide, a similar pattern when we look along lines of race and ethnicity in our state. And so depending on what community you come from, lines of race and ethnicity, there are also differing rates as well. Slide. And so there's several different components when it comes to getting vaccinated and making the decision to get vaccinated, and looking at an individual's own knowledge, awareness of the risks and benefits of both the disease and the vaccine itself, their own underlying beliefs about the role of science. There's a level of intent if they're very intentional and ready to get the vaccine versus if it's something that, if it works out on a given day that they'll do it, but they won't necessarily go out of their way to seek it. How much cost plays into it, and concerns not only of, there's still about 10, based on surveys last month, there's still about 10% of the population that isn't aware that the vaccines are free. That's a result of our healthcare system not providing universal care. And then again, the effort of getting there. And then the cost of, wondering if I have a side effect, whether or not I'll be supported in taking time off, or if I can afford to take time off if that happens. And then once the individual experience with vaccines, before, if there's also ways into they're making the decision. So really vaccine deliberation is the term that I generally prefer over hesitation most of the time. Next slide. There's been a lot of different surveys and studies looking at what are some of the themes around vaccination generally, and then specifically around COVID-19 vaccination, and what helps build vaccine confidence. And so that's understanding the safety of the vaccine, what the role the government has in creating and helping fund the vaccine, and then as was covered quite well by Stacy, kind of different things to consider around different mandates and policies, the role that political ideology plays in folks' identity nowadays, and how that may impact their views on things like that, vaccines and science-based interventions. The role of alternative health practices versus what's called Western medicine, or our science-based medicine, and then more and more circulating of certain theories, and then certain religious and moral objections may come into play as well. Next slide. And then click it once more. And so, there's kind of four different categories of attitudes towards COVID-19 vaccination that have really been acknowledged. That's those folks that are really eager to get vaccinated and are lining up, who are on websites clicking refresh over and over this spring, trying to get their shot as soon as possible. And there's the folks that are complacent, that are really against it, but again aren't necessarily going to go out of their way to get it. And then there's the folks that are hesitant, and that they are kind of will come around likely eventually with more information, more time, seeing more people in their community and people that they know get the shot, have a good experience, and be protected. And then those who are frankly going to refuse no matter what. And that's something that you see with other shots. It's not unique to COVID-19. And so, we're clearly at this point now where vaccines have been widely available and accessible for a couple of months. Pretty much all the folks that were eager to get it have been able to get their vaccinations, and we're really working on decreasing barriers and working with folks who are either complacent or hesitant as well. Next slide. So there really isn't a one-size-fits-all approach. There's no even a cookbook approach to saying, if you have someone in your life that's really struggling with the decision to get vaccinated, here's what you do, and this will solve all their concerns, and then tomorrow they'll go and get their shot. I think it really is relying the relationships you have and the trust you have with folks that you know more directly. Really starting out with the questions for what are their concerns, and not necessarily launching into everything you know about it, or say, point to this resource or that resource, this study or that study. This is very similar to how I have conversations with parents every week about vaccinations, and I often start with what have you heard, what questions you have, and then if concerns come out of that, really try to address it and provide the information there, instead of saying, this is what you need to do, this is what you should do, this is what you have to do, and really. So that is where identifying a credible messenger, whether it is a healthcare provider, which in many surveys, physicians, someone's personal physician that they know and who knows them, it usually is one of the top trusted sources of medical information. But we also know that there's certain communities where it's no longer the physician that's the trusted messenger. It's people in their community that they know and who've had a good experience and can speak to that. Next slide. So again, you want to acknowledge the person's concern, or again, often can be not so much that they're against getting the shot, but they list several barriers, and so helping them think through how to address those barriers. Certainly, as employers, you have a lot of ability to help decrease barriers and access to vaccines for your employees, and there's even some federal support to get tax breaks if you do offer that paid time off to support vaccination. And then really understand that there's a lot of evidence that some of these conversations take multiple times. And so someone who is vaccine hesitant isn't going to necessarily just flip a switch after one conversation. It's likely going to take multiple, and you might be one of several people in their lives talking to them about it. And so that over time has been shown to help folks feel ready to get their shots. Next slide. So really, again, encouraging folks to ask questions, pointing them to good resources. So MDH along with TPT now and WellShare International produced culturally specific kind of questions answer sessions earlier in the year that are accessible. And so really working with members of the African American community, Hmong community, Latinx, Indigenous, and Somali communities specifically to have kind of Q&A sessions where a lot of these initial concerns and questions about the vaccination are addressed from directly again from community members and from medical professionals in those communities. Next slide. I really like this resource of conversation between us about us. It's made by Kaiser Family Foundation to really target Black and Hispanic communities in particular, the physicians, scientists, and researchers who are part of the videos are all from those communities. However, they have done a really good job of having these really short, to the point answers to a lot of the different questions and myths that are out there. So I think it really is applicable for everyone. And so it's a resource I really recommend pointing all of your staff to if they continue to have questions, or if you yourself have questions. Next slide. And then I don't know if you can click, if it'll work from your computer, but I did embed one video for folks to just see what it looks like.
I will open this up.
You can play it. Just
Sorry, are you hearing audio? I wasn't sure that there was a video in there. So
yeah, I'm not.
1 second, let me redo the share here.
No, no. What the vaccine is doing is just helping your body do what it naturally does. It's not doing anything different. It's not changing who you are. It's not changing your DNA. It's just helping you make these antibodies. And antibodies are what you make when you get sick already. You make specific antibodies to fight different types of diseases. So this is just helping you make an antibody that will fight COVID.
Slide. So really, take homes are the vaccine is safe and effective. Reminding folks that the vaccine is free, but that not everyone has the same access to the vaccine or reliable information. And so really helping to ensure that you and your employees, I should say, have that access. And then it's okay for people to still be asking questions and really kind of invite conversation, knowing that might take multiple times to really get folks the information they need to feel comfortable to make the best decision for themselves and their family communities. And you can, I think, actually play this one too if you want. I'll have a short example of some of the videos.
From this virus. We see what it has done to families. Children can't go to school. People can't congregate. We see the elevation in mental health and mental distress that's occurring in our neighborhoods and with our families and in our workplace. And for me, that's not just sustainable. It's over a year now that we've been living with COVID. It's no longer a, oh my goodness, it's oh my goodness. And so what we need to do is, arm ourselves appropriately with the knowledge, with the education, listen to the science, listen to the data.
Thanks again, and we'll do questions here or wait till after Director Ayers' presentation, but happy to be on for questions.
Thanks so much. I think we're just gonna hold those questions to the end now. And folks, don't forget to just be putting your questions in the Q&A module, and we'll turn it over to Chris now.
Thank you. And my intent today is just to kind of give you an overview of where we're at with COVID-19 in Minnesota at this point. So just kind of a broad base of what things look like. I think it will help inform both of the previous presentations in the sense that although things are getting better, there are still things that we're concerned about, and that's why vaccination remains so important. So next slide. And I really love this quote by Charles Dickens from The Tale of Two Cities. And I think that it really kind of reflects where we're at with the pandemic. It's both the best of times and the worst of times. It's the age of wisdom. I mean, the fact that we had a vaccine within a year of the virus being identified is phenomenal, but it's also a time when people are rejecting some, very common public health mitigation guidance, and that's really surprising. There's been a lot of very positive things that have happened, and yet it's been a discouraging time because we've been separated, we've lost loved ones. So it really is a paradox that we've been living in over the course of the last 18 months. And so even as I'm, sharing information with you now about where we're at with the pandemic, there remain some of those paradoxes. So it's the best of times and the worst of times. Next slide. The good news is that when we look at the metrics that we have been using to evaluate, where we're at with the pandemic, we have finally gotten to the point where we're all in green. And that's a good thing. When the last number of months we've been in red because of the number of cases and things. But right now what we're seeing is our test positivity. So the proportion of tests that are positive is low, that the number of cases that we're seeing has really dropped. We're seeing hospital and ICU admissions slowing, and we're seeing, slow increases in vaccination coverage. I do want to acknowledge that this place that we're in may be in part, obviously it's in large part because of where we're at with vaccination, but there is some also residual benefit from the spring case wave that we saw. Some of those individuals would still have natural immunity at this point. But the good news is that we are at a place now with the pandemic that really we have not seen since the pandemic started. So that's very positive. Next slide. This is just the epi curve showing, where we've been over the course of the pandemic. You can see the large peak was the peak in cases we saw last fall. And if you hit again, I think there'll be 2 more arrows that show up. And so what you see is that as we were going into the spring wave, we really were concerned because we saw the same pattern that we had seen in the fall where we moved into really exponential growth. And the good news is that this spring we did see a peak, but we did not see that exponential growth. And we really think that this is attributable to the fact that we had started vaccinating. And while we didn't have the same level of protection at that point that we have now, that really helped us. And you can see where we're at now, and it really is significantly different from where we've been for many, many months. And so that's very positive. Next slide. This is looking at testing and positivity. So we have been tracking, the tests that have been conducted in the state for SARS-CoV-2, the virus that causes COVID. We've been tracking both the proportion of those tests that are positive as well as the number of tests that have been done. And so the purple bars that you see reflect the number of tests that are being conducted. And then the purple line and the sort of white line, that reflects the proportion of those tests that are positive. And what you can see is that we have really seen a decline in test positivity. You can see that we were at 1.1% this week compared to 1.3% in the previous week. Now, the one thing that we do have some concerns about is just the testing volume. People are just not getting tested at the same rate that we have seen in the past. And you can tell by the purple bars that, for instance, in the fall, we had a lot of testing done, in particular right before Thanksgiving. So we've seen our testing volume decline to 133.5 tests per 10,000 people. That dropped from 144.3 on June 20th. And just by way of contrast, if we look back even to just May 30th, we were at 204 tests per 10,000 residents. So that is something that we will continue to watch, and just something that that we want to monitor, because it's great to see our test positivity decline, but we want to make sure that we're still testing a sufficient number of people. In the lag period, our volume continues to decrease. And when we talk about the lag period, what that acknowledges is that as quickly as we get data in, it's not instantaneous. So we're still getting more data in before we can really speak, with confidence about a week. And so in that lag period, what we're seeing is that we're still seeing the number of tests go down, but it does look like positivity is increasing a little bit. Now, the positivity in general is low, but we want to continue to monitor that increase. Next slide. This is just a slide that I think is really positive, and it shows the impact of vaccination on long-term care. I think, as you know and recall, our long-term care residents and elders have been particularly hard hit by COVID, and our early vaccination was directed toward healthcare workers and our long-term care population. And what this graphic shows, and it looks like perhaps the key is cut off just a bit, but residents are represented by blue bars and staff by orange. And historically, we were seeing the majority of cases in residents. And this actually, just to be clear, this starts with the first week in 2021. So this doesn't even go all the way back to the beginning of the pandemic. But in general, we had seen residents as the group that was hardest hit by COVID. And you can see once we were able to start vaccinating, we saw that the number of resident cases really declined. What we've seen is that our resident coverage is about 90%, whereas coverage amongst staff is 50 to 60%. And you can see the impact that that vaccination has had on our case numbers. Next slide. So amidst the good news of cases declining and test positivity down and vaccination being widely available, sort of the bad news, or the worst of times, is just the presence of variants. And you've heard about variants in the news. First, it was kind of a string of letters and numbers, and now we're using the Greek alphabet, but Alpha, Delta are all things you've been hearing about. Variants that we see with the SARS-CoV-2 virus are kind of what's expected. Variants emerge as a virus replicates, and that replication happens when the virus is transmitted. So it's normal. I mean, all nucleic replication is going to result in errors. And the more replication you have, the more chance you have for errors. And those errors really is what results in mutation. Now, I want to acknowledge that it's of interest that the rate of mutation for the virus that causes COVID-19, SARS-CoV-2, is actually relatively slow compared to other viruses. But we have just been seeing so much transmission or so much replication that we're seeing more mutation. So it's not necessarily that there's something different about this virus and that it mutates more. It's just that there has been so much transmission globally that we're seeing these mutations. And, you know, if there's an advantage to the virus with a mutation or the presence of a variant, then that continues. Next slide. And the reason that we care about variants is it's a little bit different than just saying, well, do you want a chocolate cupcake or a strawberry cupcake, or do you like blue or green? Variants really can impact how the virus affects us. It can cause the virus to spread more quickly. It can affect the virus's ability to cause more severe or more mild disease. It can allow the virus to evade detection by specific diagnostic tests. It has the potential to reduce the susceptibility to some of the therapeutic agents and treatments that we have available, like monoclonal antibodies. And it can have the potential to affect vaccine effectiveness. And so that's why we express, such concern over variants. We obviously have seen our case numbers really decline, but we've seen that the cases that are circulating in Minnesota are caused by variants at this point. And that's why this kind of list of what variants have a potential to do, that's why we are really tracking them and are concerned about their presence in our state. Next slide. So this just gives you kind of a picture through an epidemiologic curve of what we're seeing in terms of variant growth in Minnesota. We estimate that over 85% of the cases are caused by variants at this point. And you probably recognize that when we initially started talking about variants, whether it was B117, which is now Alpha, we would say this was first identified in the United Kingdom. Or if we talk about, P1, which is now referred to as Gamma, we acknowledge that this was first identified in Brazil. And Delta B1617.2 has been tied or linked with India. So we've kind of had this sort of geography lesson as we've talked about variants. And the initial cases that we saw in Minnesota were oftentimes associated with international travel. But we have seen that we're not seeing international travel anymore. We're seeing domestic transmission, and that certainly is concerning to us. That means that these variants have really gotten toeholds in Minnesota and are circulating across our state. Next slide. And this just gives you kind of a picture of really what's been happening with variants. This looks at this bar chart shows variants in Minnesota. And so what you see is the peach bar represents B117 or Alpha. And as you recall, at the beginning of the year, we talked about, we're starting to see B117 in the state. And basically what happened was it was more transmissible, and it fully took over in terms of being the predominant strain circulating in our state. But what you've seen is over time, we've had some other variants introduced, and P1 or Gamma is, has started to increase in Minnesota. And you can see in the last 4 weeks that Delta, which is kind of the darker orange color in this graphic, has gone from less than 1% of our variant distribution. So when we look at overall the number of cases associated with the different variants, it was less than 1% 4 weeks ago, and it is now, over 10%. So I want to acknowledge just, that we really see these variants move quickly across our state. So again, that's why we take them very seriously, and that's why we are really working to make sure that Minnesotans have access to vaccines and have access to vaccines in places and locations that are comfortable for them. Next slide. This is just provides more specific information about the various variants. You can see, because why make it simple? You can see that the Greek letters are the World Health Organization label. Then there's the Pango lineage, which is the alphanumeric mix. But what I want to point out from this particular table is just that, when we look at variants in the state, what we're seeing is that the hospitalization, so the proportion of, cases that are hospitalized are higher among individuals who've been infected with a variant strain than individuals who were infected with the original or classic COVID. And so that's concerning, that we would overall, if we looked at all the cases that we had seen, we would see that hospitalization represented about 5% of the cases were hospitalized. And you can see with Delta, we're seeing a 15% hospitalization rate, with Beta, a 16%. So just want to acknowledge that we are seeing some more severe disease. Next slide. And then I just wanted to point out some data on vaccination. Dr. Chmullo talked a bit about just motivation and the need for education and making sure that people, have what they need related to vaccine. I just wanted to kind of show, this is what we're seeing right now in terms of vaccine uptake. We did reach the eager beavers and folks that were able to access vaccine more readily. And now we're in a place where our uptake is slower. The good news is it has not stopped, but we're not seeing the rapid uptake that we saw before. Next slide. And then this is one of my favorite slides, just simply because it breaks down vaccine uptake by different age groups. And you can see this 70%, which is an early kind of milestone goal. That's the red dotted line. And you can see that our 65 to 74-year-old age group, our 75 plus age group, and our 50 to 64 age group have all been vaccinated at rates above 70%. But what we see is that when we get to, the 18 to 49-year-old group, we have a way to go. When we look at our adolescent populations, we definitely have a ways to go with vaccination. So yes, we've had some areas where we have success, but we have a lot of people who still have not yet had the opportunity to be vaccinated. Next slide. So in conclusion, kind of back to the best of times, the worst of times, we're seeing our case numbers decreasing. We are certainly seeing test positivity has decreased. So those are all good things, as is the fact that our statewide coverage for 18 plus is at 70.4%. That's positive. But as Dr. C talked about, that's not true for every population, and that's not true for every geographic area. So we have work to do. And then on sort of the concerning side, we are seeing increased circulation of variants and slowing vaccination uptake. And so those are things that we're going to continue to monitor and that we want to make sure that we're attentive to, because those are things that are a bit concerning. And then the last slide is just thanking you. And so that's all from me. So I'll turn it back.
Thank you, all of you. So we are going to flip to Q&A. So thank you for all the folks who have put questions in the Q&A module. If you have questions, they pop up over the next 10 to 15 minutes, keep on typing it in. So I will just go ahead and start with a question that a few people gave a thumbs up to. So a question around, can employers ask for proof of vaccination? I think we got the thumbs up that we can ask for a, yes, no, did they get vaccinated? But question about proof of vaccination. Who wants to take that?
Want me to jump on that one?
That'd be great.
So this is a little bit confusing in the guidance that the EEOC has given us, in that we can ask for whether or not employees have been vaccinated, because it directly impacts safety, health, and well-being of our employees. And yet we have to treat that as confidential information as well. So very careful for you to monitor who has access to this information. And just like any other confidential piece of information, you would want to make sure that only people that legitimately need to know about that information have access to it. So sorry for the somewhat confusing answer, but the guidance is still a little bit tenuous from the EEOC.
Thanks, Stacy. And I think this next question that had a lot of thumbs up might also be in your lane. So a question around accommodations and exemptions for vaccination requirements. So, can you tell us a little bit about the requirement for stating a religious exemption? And is there also a personal belief exemption?
So the EEOC is clear in that if you have 15 or more employees and you're required to comply with the equal employment laws, that you would be required to provide a religious accommodation. And so you would start that interactive process with the employee and figure out what, some details around why they're asking for that accommodation in order to determine, next steps in regards to what you're going to do around that accommodation without undue hardship. So in the same thing with disability accommodation, if someone has a medical reason why they cannot receive a vaccination, same thing, start the interactive process, engage in a dialogue, a conversation, and determine, what accommodations you could make without undue hardship for your organization.
Thank you. Another question in the chat. So when might we expect vaccines to be available to young children, especially those entering school? Do we have a timeline?
Just to make sure everyone's aware, there are vaccines that are currently authorized for use for 12 years of age and up, the Pfizer and the Moderna vaccine. But we also are waiting on vaccination for the, school age younger children. And we've heard that would be expected this fall. Originally, the timeline had been 2022. And more recently, we've heard that the vaccines could be authorized as early as this fall. So that is a positive bit of news.
Thank you. Yeah, that's exciting to hear. Another question in the chat. So a little bit about social distancing and whether that is still suggested for vaccinated people, and then taking a step further, what about groups where there are both folks who are vaccinated and not vaccinated, or you're unsure about the status?
Well, a couple of things have changed over time. And that is, and I think this has been confusing to people, we've had the executive orders in Minnesota where the governor has, put specific mitigation guidelines in place. Those executive orders are no longer in place, but some of the guidance certainly still makes sense. There's, for instance, there's no requirement for masking, but CDC recommends that individuals who are not yet vaccinated should continue to mask. And social distancing certainly is not wrong to do, particularly if you're in an environment where you have a mix of vaccinated and unvaccinated folks. But and same thing with masking. I mean, it's never wrong to wear a mask, but I think that there is no specific executive order anymore that requires social distancing. What I've noticed when I've been out and about, for instance, in retail locations, is that many of them still ask people to consider the social distancing. And I think that's just fine. But yeah, if you're vaccinated, certainly you have protection, but it doesn't hurt to continue some of those social distancing things if that's what's being asked by a retailer or something.
Great, thank you. And is there guidance, this might be for Stacy, about asking about or acquiring vaccines from members of an organization who are not employees?
Interesting. I guess I don't know.
Well, what I think this may be related to is that some healthcare organizations, have mandated vaccination across the country, in part because of the very vulnerable populations that they serve. And as part of that, they will extend that to contractors or volunteers, that type of thing. So that may be what people are thinking about, where vaccination is, people are asking for vaccination information when it's not a direct employee, but it could be in a healthcare setting if they have that in place.
Thank you. A question hear about, how can we encourage our employees who are still skeptical about taking the vaccine? Any ideas?
Yeah, so I'm, certainly first trying to start with a random anonymized survey of employees about what their questions, concerns are, so that you can kind of get a sense that there's certain barriers. As I said, there is support from the federal government to offer things like paid time off if they experience any side effects from the vaccination itself, so that they can again not have that as a barrier. There's actually just an extension for the month of action the Biden administration had provided and worked with certain childcare agencies to provide childcare during immunization, and so that's been extended to until Labor Day, I believe. And then there's transportation through Uber and Lyft to certain vaccination spots. And so it's just kind of first getting through and seeing if there's any barriers that you would help address. The incentives are, as Stacey talked a little bit about, them certainly allowable, and we've seen some success with that. For instance, right now, Hennepin County has a $50 incentive for any of the doses, first or second dose, that someone gets at a Hennepin County vaccination site. And so looking at directing folks to incentives that exist, or providing an incentive yourself, as some employers have chosen to do, and really kind of just looking, at what are the benefits of it, and then certainly, being realistic, like if it is something that is really important, thinking about how if folks choose to be unvaccinated, even after you've taken multiple steps and opportunities, then maybe thinking about requiring testing at certain intervals more often for folks who are unvaccinated, in order to help protect them and your workplace and those that you're working with, and thinking about what it might have to look like having a workplace that is split between vaccinated and unvaccinated, and that is kind of another type of incentive to get vaccinated, is that you don't have to deal with some of those other things like more frequent testing. But I think it's very reasonable to think about how that can be part of the stepwise approach you take towards helping encourage your employers and those you're working with.
Thank you. Those are all great comments. Any other thoughts on encouraging vaccinations, or did Nathan really just hit it out of the park? Seems like you did. Thanks. So it seems like there's just like a little bit more clarification on this question of asking for proof of vaccination. So it seems like folks are hearing that employers can ask for proof of vaccination as long as they're keeping that info confidential, private. Is that what we're saying?
I think that's the gist of what the guidance is from the EEOC, and that employers, if you have a legitimate reason why you need to know, so come always back to that. Is it job related? Is it consistent with business necessity? Is there a reason why you're asking this question? Most employers are going to say, yes, we want to build a guide policy for the health and safety of our employees. And so then when you obtain that information, you're very respectful, keeping it confidential, who would need to know about that information, and making sure that, for example, some employers have asked, everyone wears a name tag. Can we just, their name badge, can we just put their vaccination status on their name badge? Well, generally that would probably be a bad idea, because it's not voluntary. And there could be a whole lot of reasons why people don't want that information to be like that, public for their coworkers to see. I hope that helps.
Yeah, thank you. And I guess on this question of, proof of vaccination or not, there's a question around, legality of treating vaccinated clients differently than unvaccinated clients. And they give an example. So allowing vaccinated clients inside a building and providing remote services to unvaccinated clients. Are there ideas from y'all for suggestions on best practices for maintaining high quality services in safe settings for client serving organizations? So it's a big one. Who wants to take that?
I think I'll just say that the challenge that I have is that, you know, I'm thinking only in terms of, you know, disease transmission. And so I feel like I need to always defer to Stacy because she's got the kind of that legal perspective that she brings to this. So.
I think looking at equity and make sure that you are able to provide those services for your clientele. And then the other part of that is the keeping your employees safe. So it is a difficult path for organizations to walk when they want to be able to provide services and make sure that everyone has access, and also make sure that their employees feel safe, they feel comfortable. And so I think that it would be very logical to walk through some different scenarios of how that organization can meet those goals.
Thank you, all of you. So it is 4:15, so it's time for me to wrap it up. I'm so sorry we couldn't get to everyone's questions, but there was a lot of great content that we wanted to get through. So, you know, I'll thank, you know, Stacy, Nathan, Chris for being with us today as we continue to navigate this pandemic and a really changed world. You know, the work that y'all are all doing is so important. And thanks to everyone who is in attendance today for being engaged and committed to learning and supporting your organizations. The recording for this webinar will be posted to MCN's website on our COVID-19 resource page in the coming days. And then just before we log off, I will note one upcoming event of interest, the MCN's ActCon, our conference focusing on fundraising, communications, and technology. It'll be taking place virtually July 27th and 29th. And, you know, go to our website for more information. And thanks, everybody. Have a great rest of your day.